So I'd like to introduce our speaker for today, our very, very good friend, Julie McKinney. You've probably seen her throughout the conference. Julie's worked on a variety of health literacy projects for the past 20 years. She's done extensive work for World Education, Exceptional Lives, which, did anybody go to the session on Exceptional Lives yesterday? Okay. And also she works for us, the Institute for Healthcare Advancement. She is the moderator for the listserv, which we support and do. So thank you for all of that great work. By the way, if you've not signed up for the listserv, please make sure you do that before you go. We will not let you walk out the door. Well, we will, but sign up for the listserv. She has moderated that list since 2004. She's written health literacy curricula, resource guides, and plain language educational materials, and designed and conducted health literacy trainings. Julie has a long and extensive background in the world of adult education, and this is just a field that we have always been very passionate about, that we as the health literacy, health equity community need to partner with a little bit more closely. And so Julie's going to talk a little bit about that and give you a little bit more insight into some of the power that happens when that adult education process moves forward. So without further ado, please welcome Julie McKinney.
Thanks, Michael, and thanks everyone for hanging in here. This has been an awesome conference, and I was really impressed by the panelists yesterday and by my Exceptional Lives breakout group participants. Everyone has so much energy and engagement in this conference, so I'm really excited about that. Can I just add, I'm here to talk about adult basic education and health literacy, and it's funny, it's something that I've been like fantasizing about having this presence at this conference for years and years and years. And so finally Michael says, okay, great, you can do it. So anyway, can I ask how many people here are from the adult education field? Okay, few of you, good. Has anybody here partnered with an adult education program? Okay, great. So when we come back next year, what I'm hoping is that way more hands go up at that one, because I'm going to tell you why it's such a great idea and how adult basic education is so related to health literacy. What we're going to do is just talk about adult basic education, what it is, who they serve, how what's the percentage of people who have these struggles. We're going to see why ABE programs can help work towards the health literacy goals that we're all working towards too. So it's a great synergy that we can provide. We're going to look at some partnership models and can tell you a few stories about some of the partnerships that I've been involved in. And I'm hoping that you'll walk out of here with ideas and tools and resources and some excitement to partner with adult basic education programs to improve your health literacy efforts and help educate your community. So just going to go over a little bit about adult basic ed. ABE, you see these acronyms. ABE is Adult Basic Education. And what that includes is not just reading and writing. A lot of people tend to think, literacy classes, they teach you how to read and write and decode text, and it ends there. But it's way more rich and involved than that. And so they do, in ABE programs, they do basic literacy, they do reading and writing, they do numeracy, they do math, but they also work at using these skills in people's lives. And they do a lot of practical activities, they do a lot of practicing, processing. So as I hope you'll see over the next hour, that it goes way beyond just those very basic skills of reading text. And then you'll see the terms ESL or ESOL. They're the same thing, but they're just sort of one's slightly more politically correct. English as a second language is what ESL has been called for years. They realized that so many people in these classes, it wasn't just their second language, but it was their third or fourth or fifth. So they changed that to ESOL, so for English for speakers of other languages. So again, they're the same thing, but people who are learning English in their new home country to be able to function better in society. ASE, adult secondary education, so there's also education for adults who are trying to get, who have pretty good literacy skills, but they haven't finished high school, and they want to get a high school equivalency. You'll see the term GED for general education degree, so there are a lot of GED training programs for adults who are practicing to take that GED exam and get that document to help prove their education. And then we have different types of literacy. So, there's workforce literacy that's meant to help people get the competencies they need to get a better job. There's financial literacy. People need to learn how to manage their money, and there's a lot of literacy and numeracy skills required for that. Health literacy, does anyone know what that is? And then digital literacy, family literacy, there's all kinds of, there are some programs that focus on one aspect or another. But what they all have in common is that they're using basic literacy skills to help people improve their lives. So looking at definitions, just doing this as a way to sort of expand the definition. We did this with health literacy too. Over the years, health literacy has evolved into a much richer, expanded concept rather than just understanding health information. So, if you look at the dictionary, you might see literacy as the ability to read and write. But then you can find some more rich definitions. So using this information to develop one's knowledge and potential. That's the one that the National Assessment of Adult Literacy used. And then, you talk about functioning in the job, in the family, and society. That was the Workforce Investment Act, the original one. And then I brought this quote from Don Nutbeam's article because he's done a lot of work around literacy and health literacy and how important the literacy piece is. He says the narrow definition of health literacy misses much of the deeper meaning and purpose of literacy for people. One approach identifies types of literacy not as measures of achievement in reading or writing, but more in terms of what is it that the literacy enables us to do. So I think this is at the heart of why adult literacy programs, by teaching those basic literacy skills in the context of using that to improve your life, is really treating literacy as a resource for living, not an end into itself. So we've all seen this data. So we're going to take a look now at what are, how many people have these literacy challenges, and this is the results from the National Assessment of Adult Literacy. So this is the health literacy. So you'll see measures of literacy and health literacy. Often the prevalence is very similar, but we know that the concepts are a little bit different. So what we found in the NAL from 2003 was that only 12% of adults in the U.S. have a proficient level of health literacy. And I'm sure that you're all familiar with this, but they put literacy into different categories. Below basic and basic, so the gray and the blue triangles there, those are people who really have really extreme challenges with literacy. And these are people who are marginalized in many other ways. And those are often the people that are sitting in the adult basic education and ESL classrooms. And these are the people that the panelists talked about yesterday. So these are people who we as a field really need to support, because those are people whose health literacy skills puts them at very high risk of having poor health. But the good news is that they can improve these skills, and that can lift them up and bring them into closer to the proficient level. And again, just to reinforce this point that the bar for this was very low. So in order to get into that 12% proficient level of health literacy, you had to be able to look at a chart. You know those charts with, okay, can I get Medicaid? So what's my family size? What's my family's income? I go over on the chart and, okay, yes or no, do I qualify? If you could answer that correctly, that was bumped you into a proficient level. So that's an example. Okay, there was more than that question. But so it's not a very high bar, so that's why we're saying that people really need to be at the proficient level in order to take care of their health adequately. So, while literacy isn't the entire piece of health literacy, as we know, there are a lot of other skills involved, but literacy is still a very basic skill that you need in order to have good health literacy skills. So sometimes I think we've sort of moved away from that, and when, like in our efforts to say, oh, health literacy is more than just plain language, it's more than just literacy, we don't want to blame the patient. And so we've actually come way over onto the side of putting the onus on providers and lowering barriers to people who struggle with literacy. So sometimes I think now we have to sort of go back and remember that we do need to support the skills, the basic skills of adult learners and people who need to improve their literacy skills. Just a little bit more on, statistics in the state of literacy. After the NAL, the National Assessment of Adult Literacy, they didn't do another one. They did that every 10 years for a while, but now they have switched the way that they're measuring literacy, and this is an international one. And I think that's why they dropped the health literacy piece from it. So now they're no longer going to redo the NAL to check again for health literacy. This is what they're doing now, and it's called the PIAC, the Program for International Assessment of Adult Competencies. And this came out, I think, in 2015. And they started with, I think, 26 developed modernized countries around the world, and they tested literacy skills, numeracy skills, and problem-solving in technology-rich environments. We can see how all of these are really important for health literacy. But the news for the U.S. at least was not good. We were only higher than 5 countries, so we are pretty low on the totem pole in terms of literacy skills compared to these other developed countries around the world. Numeracy was even worse. We were only higher than 2 countries in numeracy skills. So this should be sort of the second wake-up call. I think the first wake-up call was the NAL and realizing how many people struggle with literacy. And the PIAC now is showing us that we struggle with literacy and numeracy. I didn't have a slide for the technology and problem-rich environments. We weren't quite as low for that in the U.S. But in any case, it shows that we really have a lot of people in this country who are struggling with literacy and numeracy. And we have programs in place, but they need more support, and they're key to helping this population, which is a pretty big chunk of Americans anyway, and they're finding similar results around the world. So we need to work on helping these people. So English language learners, so people whose primary language is not English, we know that their health literacy is lower than people whose primary language is English. That's sort of a no-brainer, but it's proven. So this information here comes from a third look at the NAL data that R.V. Reichard and I did. And we went back into the data and looked a little bit more closely because they had data for, if you spoke another language, if you came from a different country. So compared to people who speak English, these are what we found. People who speak Spanish but have learned English through an ESL program are still 5 points below, and this is just in terms of the score for health literacy. So People who speak Spanish and have not learned English through an ESL program are 9 points lower. And we know from the NAL data that Hispanics had the biggest health literacy challenges. But then we also looked at it and found that people who speak other languages besides Spanish, and this is interesting because we know that a lot of information is available in Spanish. A lot of it isn't available in other languages too, but I think people who speak Spanish may have an advantage because a lot more information is available in their language. But people who spoke non-Spanish languages, even though they were in ESL programs and were learning English, they were even much lower. So we know that we don't do a good job in this country in helping people who speak other languages to create health literacy skills, to develop health literacy skills. So this is why ESL programs are an excellent place to work on these skills. And I'll talk a little bit more about what these programs look like and what they do. But we know it's a challenge, and we know that ESL programs are something that we have to do a better job with. So we've all seen this. So I mentioned a little bit about this before. So health literacy, it's both sides, right? So it's individual skills need to be improved in order to have better health literacy and then therefore better health. And then the demands and the expectations of the healthcare system need to be lowered so that people have better access to information and services. I think in this conference, in this group, we tend to talk a lot more about lowering the demands and expectations, which is awesome because I think early on in health literacy's journey and evolution, they found that adults had poor skills, and they thought, okay, well, they need to increase their skills. But then there was a backlash. It was just sort of, oh, well, that's sort of a blame the patient approach or blame the individual approach, right? Because we realized that the healthcare providers and health educators and the healthcare system, the barriers to accessing care and understanding information were so high that everyone's going to have trouble with it. So it wasn't just blame the patient or the individual. So now we're doing a lot of excellent work, as we've seen at this conference, in lowering the barriers, training healthcare providers to speak more clearly, to write things in an easier way to understand, to design their systems to lower some of these barriers, and that's awesome. But so what I want to talk about today is just adding in that piece again of improving the individual skills, because we need to do both of these things in order to improve people's health through health literacy. So I like the Calgary Charter definition of health literacy. One, because it talks about allowing the public and all personnel working in health-related contexts to do all these things, okay? It involves finding information, understanding it, evaluating it, communicating about it, and then using it to improve health. And if you look at what the skills are called out to be, they're reading, writing, listening, speaking, numeracy, but also critical analysis, communication, interaction. So again, these are all of the things that are happening in adult basic education classes. And they're working with teachers that are experienced and trained to teach these skills. So again, you can see how an ABE classroom is a place where all of these skills are being enhanced in a very supportive, trusted, interactive way. So I'm sorry to read another slide with a lot of text, but I just thought Don Nutbeam said this so well. I just wanted to use his words. This comes from a study defining and measuring health literacy. What can we learn from literacy studies? And he says the reason we care so much about literacy is that even the most basic functional literacy skills enable people to better develop their knowledge and improve their potential to achieve personal goals, and through this to participate more fully in society. And he says responding to low levels of literacy in a population involves improving access to effective school education and providing adult literacy programs for those in need. And we're finding that there's a huge, huge need for it. Achieving high levels of literacy in a population is not only a vital development goal, but it will also produce substantial public health benefits. So through the research and analysis of it, we know that this is a key intervention that can bring people up and improve public health. So since I bored you by reading text on a slide, I'm going to compensate by showing a video. And I'm going to talk about partnerships a little bit later, but I want to show you this video. It's my favorite video of adult education program in action. And it's a partnership between Harlem Hospital and the Mid-Manhattan Learning Center in New York City. This was years ago done by the Literacy Assistance Center in New York. And the students toured the local hospital. They did a lot of prep work with their teacher beforehand, learning vocabulary and concepts. And then you'll see what happens in the video. And then I'm going to talk about the partnership aspect in a little bit. So can we do the video, please? Thanks.
They say when patients come to a hospital, they forget what the food was like. They forget their doctors' names. They don't forget what care they had.
It's very difficult when you come to this country because it's new life for me. And first time I was pregnant when I came here. And it's not easy to interpret exactly the way the doctor talked to interpret the person. It's not easy.
Porque mi niño necesitaba un rayos X que tenía un hematoma dentro de la boca y el doctor no me explicó que le tenía que sacar el diente al niño. El niño estaba muy miedoso porque le pusieron la camisa de fuerza y le sacaron el diente. No le puso pasta, no le puso ninguna anestesia y el niño estaba muy miedoso. Él todas las noches despertaba llorando con mucho miedo.
This project is intended to help students to access the healthcare system. There's quite a concern that many of you don't have access to healthcare facilities. Many of you don't understand the system.
For our community, understanding the language of healthcare is sometimes the difference between life and death. We want to build a bridge between people who want to learn and people who want to teach. We've accepted the challenge to explain healthcare without using a whole lot of fancy words, big sentences, and big terms.
When students see it in a book and read it and learn the vocabulary, it's not real until you come to the actual real place, the hospital. That just affirms everything that we do in the classroom. So the hands-on is what I'm trying to say is so important.
Now, triage is a term which basically talks about sorting out. We're trying to sort out who is the most sick and who is the least sick, okay? Who is the most injured and who has an injury that can wait a little bit. I do want you to keep in mind that sometimes there's some people inside that are much more sick at the time, okay? And I wish we could see everyone in 5-10 minutes, okay? But it's not always possible because sometimes things come in bunches and we have limited staff and we have to do what we can to get through it as quickly as possible.
The goal for managed care is basically to get everyone insurance. We have several health plans available, and as we come into the clinics, you'll notice that patients will congregate in one central location first. That's our customer service location. And what we would like each patient to have is insurance. Our mission at the hospital is to have them have insurance. Now, we are a city hospital, as I said before yesterday, that our mission is to treat everyone, regardless of their ability to pay.
After when I went in the emergency room, it's very, 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 very beautiful. But it is different. And another hospital, maybe I'm from Africa. The people of Africa is not rich as the people of America.
Then we went to another very beautiful house, the maternity. It was the first time I saw a place to give birth so beautiful, because I give birth twice, but it wasn't so beautiful like this. They make the place where you are going to give birth, they make it's like a living room, because there is a bed, there is a computer. During your work, your husband can go to the internet. If you want to sleep, there is a couch, there is plants, beautiful picture on the wall. There is space. The bathroom, there is a tub, because usually there is no tub. And it's spacious. You can take a bath. The bathroom is spacious, because usually hospital bathrooms are too small, too tight. It's only a shower, but there is a bath. The bath is beautiful.
And you can have your baby in that room?
Yeah, you can have the baby in your room. And there's another place for the older children. If you have older children, they can play over there. All the family can come. They make that. It's new, but it gives me like having another baby.
Yeah.
I think this week, for me, it was so motivating. We had a lot more excitement in our room this week than we had all semester. Mm-hmm. The attendance was better, and the work that they did was better. They did a lot of work. They worked together very well. They asked a lot of questions, and they were very surprised about meeting these people, how the people at the hospital were so respectful, how kind they were, and how they seemed to really care about their needs, which was very different from a lot of preconceptions that they had.
I feel like the goal of navigating the healthcare system, which is what this is all about, from the feedback that I got from my students, I think it has been accomplished.
Okay, now it's much easy for me to go to the hospital, to emergency room, to explain to different doctors, because I understand a lot of medical terms, and I feel comfortable now. I'm not afraid.
Okay, my name is Lucila Silva. I am studying clinical work with Ms. Tila Ilahi. And yesterday, I visited the Harlem Hospital emergency room with 6 classmates. And yesterday, I changed my mind. 2 years ago, I said I never back to the Harlem Hospital. But yesterday, I learned a new experience.
So what do you guys think? Wasn't that awesome? There's so many things in that video that maybe we can talk about, with questions and stuff, and when we talk about partnerships. But I like that the teacher said that the students were more engaged, and that's something interesting because they have found this in a lot of ESL programs and ABE programs when they're using a topic area to teach literacy that's meaningful and important to to people, then they're more engaged in their literacy studies. So a lot of teachers used to think, oh, well, if I address health in my class, then that's going to take away from the literacy goals I have. But they find that actually people are more engaged and they're motivated, and they work on their literacy skills with more gusto when they're involved in a topic that's meaningful to them. So that was good. So we'll come back to this and think about it as a partnership, but I want to move on and just go a little bit more into ABE and why they're good places to do this work. So what can the health literacy field gain by working with the ABE system and partnering with ABE programs? So the first thing is you get access to the diverse populations that are probably the people in your communities who might mistrust the health center, who might feel like they are shy to access it, these are people who they probably don't have insurance, they struggle with literacy, they're probably in the lower socioeconomic groups, they're minorities, they're immigrants, and they're probably the people who show up at the emergency room and don't get primary care as much, because someone mentioned yesterday, it's, that's easy, you don't have to fill out forms, you just go, they'll see you. But we all know that this drives up healthcare costs, and it's not the most efficient way to use the healthcare system. Plus, it's not healthy for people to wait until things get bad. So, but anyway, the populations that the health system is trying to pull in and trying to engage with, and again, this gets to health equity. Those people are sitting in literacy programs with a teacher they trust, with a scheduled class time. They're eager to learn, they're in a good frame of mind, they're working on improving their lives. It's really a perfect setup for reaching the people and teaching them some of these skills and how to use these skills in their daily life to access health care, seek out and understand health information, change their habits. You also can gain the community's trust. So ABE programs are places where, people, adult learners who are students in these programs are very loyal to the programs, because if they're there, they trust their environment and their teacher. And so I think adult basic ed programs are really trusted community organizations, and we talk a lot about how that is one of the organizations who are trusted in the community, or places that we can reach out to promote our work and engage some of the populations that need to be lifted up. So it's good PR. The expertise of teachers is something that I think is undervalued. A lot of times you'll do a partnership and the health center will be like, oh, we'll help you out. We'll bring a guest speaker to your ESL class and talk about, screenings or whatever, or nutrition. And that's great, but I think the health system can really learn so much from adult ed teachers and students, because the teachers really have expertise and training in interacting with that population and teaching them things in an engaged, interactive way. They use adult learning theory. They know what they're doing, and so they can really teach us a lot. And in the video, you saw that the health people were giving their talk about triage and everything. And you notice how nicely they spoke. Triage is, who's most sick, who's less sick. So they were prepped by the teachers. The teachers helped them learn how to speak more clearly to their students. So they got that out of it. So the expertise of teachers and students is something that is a high value and that people should use. So yeah, we talked about this. So they're very comforting environments, and people are ready to learn. There's a lot of things that ABE programs can teach people. Of course, there's basic literacy skills. Then there's health literacy skills. How do you find information? How do you communicate with your doctor? They do a lot of this type of stuff. How to use the healthcare system. A lot of health literacy programs taught in adult education centers. They'll talk about the different types of care, primary care, why it's important to have a medical home, a primary care doctor, why it's important to get screenings and take your children to their well visits. A lot of these are new concepts for people who aren't used to having insurance and aren't used to knowing that the doctor is for going when you're well as well as when you're sick. And as you saw in the video, they can really help increase the confidence and trust in the health system for a lot of these students who tend to avoid it. Self-advocacy, and then of course health habits and self-care. So these are some of the best practices that they use in adult education. And again, this is why they're able to connect really successfully with a lot of these populations that have inequitable health. So again, why is this a health equity issue? Because adult literacy programs and teachers, they get people to share their own culture, their own beliefs, and incorporate those into the new things they're learning. They take these new, so you won't tell someone who has a different cultural view of medicine and health. You won't say, well, that's wrong, this is the right way to think of it. Adult ed teachers will incorporate that into this new information. They'll talk about it as a group. It's a very empowering model that they tend to use. They do a lot of practice. They do a lot of incorporating skills into real life. Again, they're safe places. I think I've made this point. So there's a few examples of curricula and resources that you can use to help teach health literacy in adult education programs. One is Staying Healthy. You may have heard of this book. This was developed by the Florida Literacy Coalition with support from Blue Cross. It's an English learner's guide to healthcare and healthy living. So it was created for ESL students, but it was created to be a resource book that stands on its own. So if you're not in a literacy class or an ESL class, you can still take this book. It's written at the 3rd to 5th grade level, and it goes through a bunch of different topics: healthcare, talking with your doctor, medicines, and there's a curriculum that goes along with it. So this has been taught all over the country in many different programs to address these things in adult literacy programs. And this is sort of an example of kind of the structure. So they have a word list. They start with vocabulary. So these, teachers know the process of starting with vocabulary, making meaning out of it, practicing it. They do reading comprehension. They do dialogue. So there's a lot of speaking and listening and practicing saying some of the things, practicing talking to your doctor. And then there's other, they have numeracy exercises and other things. So it's taught in a very comprehensive way, but with a lot of practical practice. And then they do project-based learning at the end. They do, they will write a cookbook or do a health fair or write a song. They did a community garden. The HEAL program is another one, and this was from College of William and Mary in Virginia. And this is a whole package that has a series of books for ESL learners, which are either beginner, intermediate, or advanced. So you can start with a very, very early, low level of literacy, people who are just starting to learn English. And they have a program that you can train volunteers or other people in your program to teach this. So it's meant to be able to be used by someone who's not a trained literacy educator. And there's eight weeks that end up with a visit at the health center. And there's also a program for a piece that helps, that trains the providers at a center. So it's a good sort of overall package that like a health center could use to do a class for the community, and there's a training for the providers as well. And then this is another one we all know and love, the What to Do for Health series that you can get out there. This is created by IHA. There's a whole bunch of other books which you've seen on the table out there. The cool thing about this is that, and again, this is a easy to read book that talks about what to do for your child when your child gets sick. And then there's other topics as well. But it's a resource book written in a really easy to read, health literate design. And the people who've received this have been really thrilled that they have a book that they can understand, and people have really valued it. They found that when they handed this out to people with very little instruction, already they found that there were fewer unnecessary doctor visits, there were fewer emergency room visits, fewer school and work days missed, and it's because parents had something they could understand that says, okay, if my kid has a fever, I don't need to go into the emergency room. Here's how I deal with it at home. And so it really had a very positive effect that was able to be measured. So that was very cool. And then there's also a curriculum. There's also a curriculum called the Health Education and Literacy Program that you can get through IHA to go along with this in a literacy program. So I want to quickly, I'm going to skip through these, but these are available if you want to look at sort of some of these studies. We do have some evidence now that health literacy taught in adult literacy programs works. The HEAL BCC program was one that was done at World Education a long time ago, and it found improvements in navigation skills, knowledge, self-efficacy, intention to get screenings, and this was another one that this was the only, I think, like true randomized controlled study done. But they also found that that the programs like this increase literacy and health literacy. And the cool thing about this one was that they found that the lower level literacy learners made the most improvements in health literacy. So you can it works for all levels. This is another one that they did in Boston, and they tried 3 different teaching styles in a literacy program and found that same thing. There was more health knowledge, more literacy. They found that collective efficacy was a big factor in this, and that's where a group enhances the feelings of power and control to be more effective. And that sort of highlights one of the advantages of being in a literacy program, because it's a safe environment and you have a group that you're all working towards the same thing. So again, it's just a good way to address health literacy. So partnerships, wanted to save a little bit more time for these. Win-win-win situation. Do we have any Star Trek fans in the audience? Any? Okay, a few. So it just reminds me when, in the 4th movie when Captain Kirk is trying to get 2 whales, he's trying to convince the protective marine biologist to let him have these whales to bring into the future and repopulate the series. And he says, it's going to be better for you, it's going to be better for me, it's going to be better for them. And so that's how this is. It's a win-win-win. The health center wins because you get to reach those communities that are hard to engage with in your communities by partnering with adult literacy programs. They have the trust of these people. Literacy programs win because their students get to interact with the healthcare system and learn about taking care of their health. And the students, of course, win because they increase their health literacy skills, their confidence. They are able now to interact with healthcare and to find health information and use it. There's a lot of different ways to partner with literacy organizations. Just tell 2 quick quick stories. One, I used to work in the East Boston Community Health Center, and I was doing a project called the Well Woman Project, and we were supposed to recruit women over 50 who were uninsured or underinsured, and we were doing free health screenings for them. So to recruit them in the community, I went to the nearby Harborside Adult Literacy Program, and I said, I know a lot of the women in your classes would qualify for this study, and we'd like to invite them to have these free health screenings. And so they said, sure, you can come and talk to our class, but if you're going to do that, why don't you, talk about some health issues so we can do that. And they ended up being very engaged with the health center and did a lot of projects. But we, so we worked with their classes and we talked about some health issues in their classes, and then we invited their students to come and participate in this free screening, and it was good for everyone. One other example from Colorado that I thought was really cool was when hospital was charged with writing their materials at a lower level in plain language, but they didn't have much staff to do it. So they had this sort of goal, but not enough support. So they partnered with the public health school in town, where the students had just taken a health literacy class, just learned about plain language, and they were really excited to practice these new skills. So the health center would give the materials to the public health students, who would rewrite them in plain language according to their what they had just learned, and then they would bring those revised materials to the local ESL program where refugees were learning English, and they would show the students in this program the materials, and they reacted to them like, oh yeah, this I can understand, this is still, these words I don't know. So they gave a lot of really useful feedback on the written materials. So this was a partnership between 3 different places where everybody was winning and getting what they needed. So another example. So students testing written materials is a really good one. There's also been cases of teachers who have been sort of consulting to healthcare programs and to help providers and educators learn some of the skills of interacting and explaining things to diverse populations in an easy to understand way. So there's lots of different ways to do it. So I highly encourage it. This is just a list of all the different people that they partnered with the Staying Healthy Project. So there's all kinds. So what can you do? Learn more about partnerships, look at different models. I have some resources that are here in these slides which you can look at. Go into your community, meet the people who are doing adult literacy. The National Literacy Directory is a plan that a website where you can put in your zip code and find adult literacy programs near you to call up and reach out to. There's all kinds of things you can do to plan activities that engage literacy programs. And as I said, value the expertise of teachers and learners. Like, see them as a resource to help you. Sorry I had to rush so much at the end. There's all kinds of resources here that you can use, and I hope we have a few minutes for questions. So thank you for listening. Yeah, I can come to the mic.
Hi.
Thanks. Hi.
Hi. Good morning. Can you hear me?
Yes.
Yeah. My name's Fernando, and I work for the Los Angeles County Department of Health Services at Los Angeles County USC Medical Center. And over the years, we've had a lot of partnerships with local institutions that have helped us with a lot of different types of things. But over the years, I've also noticed that as we advance more into different technologies, even our workforce, who kind of fit that original pie, some fall behind because of technology. They're just not a good balance of teaching them what they need to know to move us into the future. So 9 years ago, we built a new hospital, and we lost a significant number of our workforce because they didn't want to face the possibility that they were going to fall behind in learning how to operate.
Oh,
the new
interesting.
hospital, particularly from people who probably have low literacy skills anyway.
Mm-hmm.
But
Yeah.
they felt that there was just an overwhelming challenge. I remember meeting a plumber who said, "I'm leaving. I'm retiring." I go, "But you're not that old."
Yeah.
I
can't keep
come
up.
from a world where we did this.
Yeah, yeah.
In the new hospital, we do this.
Mm-hmm.
That's why. But over time, though, I would say that a lot of our workforce partnerships have used some of the models of adult learning
Mm-hmm.
to bring these employees and keep them up to pace with the rest of our hospital.
That's
And so
great.
We've had a lot of challenges, but it's worked.
Mm-hmm.
And I think it really does benefit, even if you're just thinking about workforce people.
Yeah, no, and that's a really good point. And and there have been hospital systems who have actually put adult literacy programs in place for their employees. Because that's a good point. Is that you have to keep up with the job requirements, but also when people have poor health, then they have to quit their jobs too. So but they have done literacy programs and adult basic skills programs in hospitals systems. So for your employees, so that's another way to look to address that. But thanks for bringing that up.
Thank you.
Yeah. Hi.
Hi, my name is Faith Rader. I work at the California Department of Public Health in the
Okay.
Bay Area.
Great.
And I'm just wondering what this looks like from the literacy side. Like, do they have set curricula? Are they looking for partners? Do they get approached a lot by community organizations that want to partner with them? Or are we just at the beginning of forming these partnerships?
Right. No, I think I would say yes, and I think the person right next to you, Michelle, could probably answer better. But yeah, in Wisconsin, they've had an incredible rich partnerships with many people who are like knocking down the door to partner with you. Would you say that's right? Yeah.
We've been working with, literacy is just one of those issues that, so Wisconsin Literacy is the parent organization for Wisconsin Health Literacy, and we serve about 80 literacy programs throughout the state that are doing adult basic ed and English as a second or other language. And so it's been a really wonderful forum to be able to connect to the health literacy side of the things that we do. But also, I wanted to just mention that yesterday's panel mentioned the author, I think Chimamanda Ngozi, the TED Talk about the danger of a single story.
Yeah.
So we think about literacy, not just with health, but we were talking yesterday about housing, the criminal justice system, workforce, it goes on, the safety net system and welfare benefits, intergenerational literacy. So there is an organization called the Open Door Collective, and they are working on case papers that make the case for in connecting to adult basic education in all these other areas of work and interest on social issues. So if you just Google the Open Door Collective, there are these short case papers that kind of make the case for why adult basic education should be involved in these issues that are looking toward reducing poverty. So I just think that's another great resource to think about.
And it's actually listed in the Open Door Collective papers are there. So on the slideshows, you can get them there. Yeah.
But it just intersects, and it's a wonderful, there were a few people that raised their hand about adult basic education in terms of their work, but I just strongly encourage all of you to find a way to get engaged with that, because it will enrich your program, what you're able to learn from the people in the community.
Yeah. And again, just in answer to your original question, definitely, yes, a lot of places are literacy programs would be happy to partner. So Dory and then Rima. Yeah.
So we have, I'm Doris Ravadas from Western Michigan University, and we have a number of connections with our local literacy center. We have a health literacy class, and they review what our students write. But we've run into if we want to do research on effectiveness, the question of informed consent and human subjects, and I know that there's a educational, Rima's helped me a lot with this educational kind of exemption from that, but I'm wondering, any thoughts on that to work directly with learners?
Yeah, and I think, and I'm glad you brought that up, because I think increasing our access to research and evaluating these programs is something we really need. And it's because, literacy programs usually don't have money to do a rigorous evaluation, so it's hard to get that data. We have some really positive data that we're getting, but so encouraging ways to do studies, and I'm glad Rima's working with you, because I don't know the intricacies of those rules. But another thing that I want to add to that is, so we have this new journal of this new International Health Literacy Journal, and they're really looking for practice articles. So if you have a program like this where you're doing a health literacy program, and you want to see how effective it is, and you do your own evaluation that's maybe doesn't, hold up to research rigor standards, but talk to Cynthia Bauer about this, because they want to publish practice articles about these types of programs, even if they're not true research. So that's one thing that journal is hoping to do, is to get more of this practice stories out there. So I don't know. I know that doesn't completely answer what you needed, but it's what but thanks, Rima.
I wanted to speak to a strategy that's very important to keep in mind, because I came out of a 12-year experience of a partnership between academia. I'm at the Harvard School of Public Health, and the adult literacy world through NCSAL, the National Center for the Study of Adult Literacy and Learning. And we worked for 12 years in an intersection of the two. And the key there was an issue of respect and acknowledgement. So I did not approach the adult literacy world to ask them to add more to their burden of tasks. I celebrated the skills and the work that they were doing and the insights that they had into reading, writing, speaking, listening, math, all sorts of numeracy skills. And we worked together to build an approach that would highlight their already existing skills, but would give them an add-on that they very much appreciated. People are very interested in health, in their own health, in the health and well-being of their children, in the health and well-being of their elders, in accessing health care and managing chronic diseases. It's a motivation. So what we did was not add to the burden, but indeed we inserted a motivation and an exciting way to work, but using all of the skills that the adult educators already had and focusing on the skills that they wanted to teach. And actually, you didn't include it in your resources, but one of the things that came out of this was a compendium of training for adult education teachers that is available, that was made available in every single state. And it's called study circles. And these study circles, these health study circles, enable teachers to look at ways of integrating health topics into their already existing and strong ABE programs, adult basic education, ESL programs, as well as GED programs, which is the equivalent of the high school degree. So it's the partnership of respect and equality where you're building on each other's skills and you're really giving each other something together. And actually the video that you showed was one of our projects.
Oh, really? Okay,
yes.
yeah.
So we were working
Great.
with the Adult Literacy Center. We used the environmental tour, which very much excited people, brought them to Harlem Hospital. Harlem Hospital responded. They were very excited to have the insights from the adult learners who had come to their hospital and tried to navigate and gave them feedback about what got in the way. So Harlem Hospital put on this magnificent day. Several newspapers from New York City were there. It was on TV. It was a big event, and it changed the reputation of Harlem Hospital in the community as a result of that. But that indeed was an outcome of one of our projects in New York City, working in partnership with the Literacy Assistance Center.
Yeah.
So these study circles are available online. You can download them. One has to do with learning how to integrate information about managing a chronic disease, any chronic disease, into your adult education curricula. The other one has to do with looking at screening and prevention. And integrating that into your adult education curricula. The third is out of date because it focused on navigation. So some parts of it are useful, but this was before Obamacare and long before, you know, a lot of the new things that had come about. But that's available online at Harvard. So it's Harvard School of Public Health, hsph.harvard.edu/health literacy.
And if you, and I have a bunch of resources for adult literacy programs. So if you want any of those, which include this one, you can email me and I can send you them. We're out of time, but Sabrina, can you give like super quick? Sorry, yeah.
First of all, I just wanted to say thank you, Julie, for your presentation. I will keep it quick. I also really commend this presentation really focusing on literacy, especially with the theme of this conference being around equity. The idea of really putting adult education and literacy, you know, up front and center, and that we just need to do a lot more of that if we really want to make headways into health equity. And I also just wanted to ask you, and if you could respond quickly, around working with libraries in terms of collaborations. Libraries often have adult education programs.
Yeah, a lot of adult education classes are taught at libraries, and of course that provides a whole rich environment and resource. So yeah, reach out to your libraries as well.
Okay. Thank you.
Thank you. Thank you, everyone. Sorry it went long.